I have several patients that are like, you're the first doctor I feel like who's actually listening. And that is really fulfilling because then I know I'm doing something right. I am Glennda Tiller, DO, MD. I'm a family medicine physician here at Oklahoma State University. I have an official title here, Clinical Assistant Professor of Family Medicine. I was introduced to osteopathic family medicine early in college after I understood the philosophy of what being a DO is and how they approach patient care and all that. I was like, oh, done. Like, this is where I want to be. You know, I knew I wanted to be a DO, not just a doctor, but an osteopath. I always laugh about whenever somebody asks me what my typical day is because there's rarely a typical day in academic medicine. I work at 4 different clinics in family medicine department, but we have clinics all over Tulsa. The primary clinics that I am in are the OSU Healthcare Center. That clinic is where we train residents and medical students. It is a larger clinic, significant urban underserved patient population there. I also work at OSU Eastgates, where we also train medical students. The patients we take care of there, it's more of a mixed population, and there's a higher level of immigrants there, high level of Spanish-speaking patients. The third clinic that I work at is OSU Primary Care Legacy Tower. That is where I see my own private patients. So that clinic is more of an urban, suburban population. I get to see patients there 1 or 2 half days a week. The fourth clinic is our Women's Health Center. This clinic functions inside of the OSU Healthcare Center. It is where we get the opportunity to take care of pregnant women, do prenatal care, and really focus in on women's health-related needs. We do a lot of procedures in that clinic as well. And then I also work for OSU Medical Center. The family medicine department has its own inpatient service, and so I function as a hospitalist there. 1 half day I may be at one of our resident clinics precepting with them, and what that really means is that they are seeing their patients, and then I am overseeing the care of their patients with them. So typically they'll see their patient, they'll come to me, we'll discuss everything that they saw, everything that they found on exam, what they think the diagnosis is, and then what they want to do for the patient. I spend at least 1 half day a week at Legacy seeing my own patients. Some of them I've had since residency, so some of them I've been following for 7-8 years now. And so essentially it's just a primary care clinic. I get to participate in regular, everyday primary care experience, taking care of all kinds of different patients. I do have some non-clinical work that I do as well, where I will go to the college and teach. Whenever I think about the things that motivate me as a doctor, I think about seeing my patients make real, true change in their lives, and knowing that I was part of the team helping facilitate that. That is a team effort, and the patient and I are on that team together.